Welcome to Campus Health's Health Insurance 101, where we will learn how to choose and use health insurance. There are two parts to this presentation. First, we will be going over terms and information on how to choose health insurance. Next, we will go over terms and information on how to use health insurance. The whole goal of this presentation is to empower you to be a better informed consumer of health insurance and health care. Before we get into specific terms around choosing health insurance, it is important to know some things about United States healthcare and United States health insurance. First, United States healthcare is generally not free. The costs for it come from somewhere, be it the clinical fee you pay at Student Health Service, be it out of pocket or you paying for it on your own, or through your health insurance. Next, paying for United States healthcare can be very expensive. That leads us to our third point, that health insurance was created to help an individual pay for health care. Other important aspects to know about health insurance is that United States healthcare and health insurance are both very complex. Also, each health insurance plan has specific details and numbers for it, so even though you and a friend may use the same insurance company, the actual coverage and plan details may be very different. Later on in this presentation, we will go over what types of details to look for in your plan. Next, what may seem like the same medical problem may be treated in many different ways by a United States health insurance company due to how the medical provider treats the patient and the exact details of how the medical problem happened. We will go more into this later. Now we will start defining and giving examples of terminology commonly used in insurance plans. First is the premium. This is the amount you pay for your health insurance every month or year, regardless if you use it or not. A note is premiums can vary greatly based on the level of coverage. An example of a premium is, regardless if Sam ever uses their health insurance plan or not, they pay an annual or per year fee of $4,000 because that is the premium of their insurance plan. A deductible is a specified amount of money that the insured must pay before an insurance company will pay a claim. This number resets every year. You should check with your plan if this number resets on January 1 or August 1, or perhaps a different date. Deductibles vary greatly and can be as low as a few $100s, but as high as thousands of dollars. Here is an example of a deductible. Sam hurt their foot and needs to see a medical provider. They are home for winter break, so they do not go to Student Health Service. The medical provider they see diagnoses them with a sprained foot and charges $300. Sam's insurance plan has the deductible of $500. This is the first time during the insurance plan's term that Sam needs to use the insurance. Sam will have to pay all of the $300 since Sam has not met their deductible yet. To explain, even though Sam has already paid a premium to even have the plan, Sam still needs to pay the $300 bill with their own money because the insurance plan does not start until Sam pays $500 of their own money towards bills. There is an exception to this, which are called preventable health services, which we will go over later. An out-of-pocket maximum is the most you could pay in a year for covered services, but does not include the cost of the premium. Once this is reached, the plan will pay 100% of expenses for covered services. These, like premiums and deductibles, vary greatly and can be as low as $1,000 and as high as tens of thousands of dollars. An out-of-pocket max is the upper limit that you would have to pay. An example is, Sam's health insurance plan has an out-of-pocket max of $10,000. Sam has already met their deductible. Sam has been very ill this year, and their health care bills have reached $10,000. Now, Sam will not have to pay any more money out of their pocket for covered expenses. Again, the term out of pocket means you are paying for those costs. The total cost of health insurance is a simple way to compare different health insurance plans. The total cost of health insurance is the total cost of the premium, deductible, and out-of-pocket max totaled up. This totaled up number gives you an idea of what you may have to pay if you used your health insurance very frequently. Again, It allows you to compare different plans against each other and not just one part of that plan. There are two examples. First, Sam's plan has a premium of $3,734 per year, a deductible of $300 per year, and an out-of-pocket max of $1,200 per year. Sam's total cost of health insurance is $5,234. Sam's friend thinks they are saving money by picking a plan with a very low premium, $804 per year, but a high deductible, $1,250 per year, and a high out-of-pocket max, $6,350 per year. The friend's total cost of health insurance is $8,404, which is $2,770 more than Sam's. Just because the friend's plan has a lower premium does not mean the total cost of health insurance is lower. Before you choose a health insurance plan, you should find this document, the Summary of Benefits and Coverage document, or something very similar to this for your own plan. If you already have health insurance, you should also find this document for your plan. This is an example of a Summary of Benefits and Coverage statement. It is not for PSIP. A Summary of Benefits and Coverage will tell you what the numbers and details are for the plan. For instance, this example plan has an in-network deductible of $500 and an in-network out-of-pocket max of $7,200. As we arrive at this point, I suggest that you find the Summary of Benefits and Coverage or other documents with your plan details for plans you may be looking at, or the plan you currently have. This will allow you to learn more about the exact details of your plan. A copay is a form of cost sharing. A copay is a dollar amount that the member must pay when covered services are provided. The majority of the time you see a doctor for a non-preventative appointment, you will pay a copay. This copay will depend on your plan. Copays can be as little as a few dollars and up to many hundreds of dollars, depending on your plan and the services you are going to use. Usually, for a non-emergency visit to the doctor's office, copays will range from $20 to $100 per visit. An example is Sam's health insurance plan has a copay of $20 for a primary care visit. Sam has already met their deductible. Sam schedules an appointment to have a medical provider look at a wart on their foot. When Sam goes to their appointment, they will pay $20 before or directly after their appointment, usually at the reception desk of the doctor's office. Two things to note are, 1. Student health service never requires a copay, and 2. Once you hit your out-of-pocket max, you will not need to pay any copays. Coinsurance is another form of cost sharing. Coinsurance is a percentage that the member must pay when covered services are provided. Depending on your plan, you may have a copay or a coinsurance, depending on the type of service. The exact percentages of the coinsurance will depend on your plan and the type of services you are receiving. An example is Sam's health insurance plan has a coinsurance of 10% for a primary care visit. Sam has already met their deductible. Sam schedules an appointment to have a medical provider look at a wart on their foot. When Sam gets billed for the appointment, they will have to pay 10% of that cost, or in the example on the screen, $40. One note is, once you hit your out-of-pocket max, you will not need to pay any coinsurance. When you are looking for a place to seek medical care, it is best to find an in-network provider. An in-network provider means that medical provider has a contract or relationship with your insurance company, which results in you paying less than using an out-of-network provider. Some insurance plans will not cover out-of-network costs at all, so you should make sure to check your plan details. In the two examples, Sam could receive the exact same care for the exact same illness, but could have to pay drastically higher amounts if they went to an out-of-network provider. Here is an example of where you would click if you have an Aetna plan, like PSIP, to find an in-network provider. Here are examples of the terms we just went over. Again, This is an example health insurance plan and not for PSIP. There is a column for in-network provider costs, which are always much lower than the out-of-network costs. An example of a copay is the $50 copay per visit at an in-network specialist. An example of a coinsurance is the 20% coinsurance for in-network diagnostic tests compared to the 40% coinsurance for out-of-network diagnostic tests. As I have emphasized this entire video, you should find out the details of your plan so you know how to be the best healthcare consumer. Preventative health services are services like flu shots, certain screenings, and certain tests at no cost if done in network. The medical provider must code the service as a preventative health service, and there may be specifics about how frequent these appointments can happen. Sam wants an annual physical exam. Their insurance plan considers it a preventative health service. They check for an in-network medical provider and find an office to do it. Even though Sam has not met their deductible and has a copay for most appointments, Sam has to pay nothing for the physical. If Sam wanted another physical in the same year, Sam would have to pay for that, as they are only allowed one per year to be covered as a preventative health service. Exclusions are what the plan specifically does not cover. These are important to know, as you will have to see if they do or may apply to you and your health. An example taken from the 2019-2020 PSIP plan is the exclusion of air or space travel on a non-commercial, fare-paying passenger flight. This means if you injure or become ill due to being on a hang glider or spacecraft, for example, that the health insurance plan may not cover your costs. Sam is on PSIP and goes hang gliding. While Sam is in flight, their hang glider crashes and they are injured. PSIP would not cover the costs related to that injury because it specifically states those activities are an exclusion. Again, it is very important to look at your insurance plan details to see what exclusions apply to your plan. Some insurance plans may exclude services that may seem common, like treating acne. Common exclusions and PSIP exclusions are being injured while in war, injuries while committing a felony, injuries from participation in a riot, injuries while a part of an NCAA sports team, among many more. Also, it is important to note that some insurance plans can exclude pre-existing conditions. This would be any condition that you had before you entered into the new insurance plan. This again emphasizes how important it is to look through the plan details before you purchase a plan. A referral is a written order from your primary care doctor for you to see a specialist or get certain medical services. These are in place so a patient receives the best clinically sound advice and, for instance, does not go get a major knee surgery because their knee bothers them. Sam is on PSIP, and PSIP requires a referral for all non-emergency medical services within 25 miles of Philadelphia per condition. Sam hurt their foot, and while in Center City, hears about a great sports med doctor located across the street. Since that doctor is in-network, Sam thinks they can go to that specialist to have them look at their foot. However, Sam's plan, PSIP, requires referrals, and therefore considers that doctor's visit to the specialist as out of network. Sam should have first received a referral from Student Health Service, if on PSIP, to see the specialist. This image shows the language about the referral and exceptions to that. There are multiple types of health insurance plans. Two common ones are Preferred Provider Organizations, or PPOs, and Health Maintenance Organizations, or HMOs. Each are different and have strengths and weaknesses. A PPO allows you to visit whatever in-network physical or healthcare provider you wish, if they are in-network and a referral is not needed. However, because you could select different medical providers from different locations and groups, your care may not be fluid. For example, your previous healthcare data may not be in their system. A health maintenance organization, or HMO, generally won't cover out-of-network care except in an emergency, so you must go to their doctors or hospitals. Also, you may have to live in their geographic region to utilize their service. HMOs are usually one big system that has all types of services and specialties, so your healthcare data from across these services would be available to those providers. When choosing health insurance, the total cost of health insurance is an important number to know so you can compare plans. In this example, example 1 has a much higher premium, over 4 times as high, but has a deductible over 3 times as low and an out-of-pocket max over 4 times as high. This person would have to assess their previous, current, and projected health and how much risk they are willing to take on. If a person never used their health insurance and was fine with taking on risk of having to pay more money in the long run, then example 2 may be appropriate. If a person uses their health insurance and is looking for lower risk with less money to be paid out in the long run, then example 1 may be appropriate. Now we transition to using health insurance. Before using your health insurance, you should know the details of your plan that were discussed in the previous slides. Pause this video and take a minute to find those numbers of your plan or plans you may be looking at. Next, find an in-network medical provider or organization by going to your insurance's website and clicking a Find a Medical Provider or Search for a Doctor button, or something similarly worded to that. Again, here's the example of where to click to find an in-network medical provider when using an Aetna insurance like PSIP. A best practice for using health insurance is selecting the appropriate type of care for your situation. Generally, there are 3 levels of care: an appointment or office visit, urgent care, and the emergency room. An appointment or office visit would be for a non-urgent, non-emergency situation, such as seeing a provider because you may have the flu or having an annual exam. The next level of care is urgent care, which would be appropriate for a pressing situation defined by time or severity. An example would be to see if you broke your foot during a skateboarding accident. The next level of care is the emergency room. An emergency room is appropriate for an emergency situation defined by the damage or severity. Anytime there is a serious accident or someone is unconscious, the emergency room would be appropriate. If you try to go to the emergency room to get a flu shot, it will be the most expensive flu shot ever, and they would most likely turn you away. Utilizing the appropriate level of care helps reduce and save costs for you. Another best practice is to select a primary care provider to coordinate your care. This allows that individual or office to know your medical history better and have more familiarity. When being prescribed medicine, you can ask your medical provider if there is a generic or over-the-counter medication that would be appropriate for your condition, rather than a name brand drug. Most insurance plans have different levels of copays and coinsurance for different levels of prescription drugs. Whenever you receive a bill, make sure you review it and look for duplicate billing, inaccurate dates, or incorrect charges. If you did find any inaccuracies, contact that medical office or your insurance. Thank you for taking the time to learn more about health insurance, and one last reminder, to look up your numbers of any plan you are looking at or for a plan you already have. Please follow us on Instagram and Facebook @HealthyPen, and feel free to browse the Campus Health website to learn more about other workshops, videos, and presentations we put on for students.